With us right now is my good friend, Dr. Joe Congini from Akron Children's Hospital. Joe, you got a new team member, huh?
Yeah, Ray. I mean, the real key, if you ask Tito right now, is getting depth and getting people in there to help you on your team. And we have a new addition this summer to our sports medicine team that I wanted to highlight this morning. We really, for a long time, have looked for exactly the right person to do this. And you know that a big part of being the best you can be as an athlete is the nutritional aspects. And we have added a sports dietitian to our team this year. We've had some of the other general people on our team before, but this year we added Lindsay this summer, and she's a great teacher. Always on the sports medicine team, it's important to be a teacher because these athletes need to learn what's going to help them, what's important and what's not. She has a news show that she does on one of the local news casts once a month, I think. And so she's really, really a good teacher. She's an experienced sports dietitian and really helpful to us. And so in a couple of areas is we not infrequently at all see nutritional deficits or deficiencies. And they're not always easy to diagnose and to work our way through. I think we've talked a little bit in the past about number one, probably near the top of the list is iron. And we check a thing called a serum ferritin. And so many of our athletes, it may be as high as 15, 20, 25% have iron issues with iron. And this can lead to anemia. It can lead to reduced endurance and fatigue, not good things for athletes. So we really need to be on top of things like these deficiencies. The other really high on the list is vitamin D and calcium deficiencies. And everybody knows, I think, for a long time we've talked about that being directly related to bone health and how important bone health is for athletes. But there's also been a lot of research in the last 5 or 10 years about mental health with vitamin D deficiencies. And again, a very big slice of the athletic group of people are low in vitamin D, and not only how to supplement to get them back up to normal, but how to do a good job in your daily diet to cover the iron and the vitamin D. And thirdly, we've talked in the past about how many high school athletes are frankly dehydrated, 3 to 5% dehydrated, and they go out and they can't compete at their best. So we really want to help athletes reach their full potential, and having a sports dietitian really helps. The other issue is so many athletes ask us about nutritional supplements, and you know what a moving target this is. Just when we get a comfort zone with certain nutritional supplements that could help athletes, there's new supplements that are out there that athletes want to use, and we need to make sure that these are safe and legal, and they're really going to be beneficial, and so that people aren't just wasting their money on supplements out there. So from the standpoint of things like nutritional supplements, nutritional deficiencies, and even the really rare one that we'll see is something like an eating disorder. That's not as common as some of the ones I talked about before, but a full-blown eating disorder takes a lot of time with a professional like a sports nutritionist or dietitian who does a good job, and that's one of Lindsay's strengths as well. So we really are thrilled to be able to add somebody like that to our team, and I think it's going to be helpful to all of our athletes to help them reach their full potential.
Yeah, it's a broad range of certainly the help in so many aspects of sports medicine, that's for sure. Joe, good stuff. Glad you were able to introduce her to us, and thanks for joining me today, my friend. Get well, and I'll talk to you next week.
Okay, sounds great, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital, joining us live this morning.